Wake that ass up.
Early in the morning.
The Breakfast Club.
Morning, everybody. It's DJ Envy, Angela Yee, Charlamagne the Guy. We are the Breakfast Club. We got some special guests on the phone lines right now. We have Roger Milliner and Dr. Shah from Metroplus. Welcome, guys.
Good morning.
Good morning. Good morning.
Now, how's it going now? Now, what is Metroplus doing? We heard some things got extended. How can people maintain their health coverage? What is Metroplus doing for everybody out now that's affected with this coronavirus and COVID-19?
Well, first, we'd like to thank the Breakfast Club for giving us this platform to come on and speak to the New Yorkers and your listening audience about a lot of things that the New York State of Health and our good governor is doing to make sure that people have health insurance during this time. So if anybody's not aware, the governor originally extended the open enrollment period, which normally ends around the end of February, and people would have to wait another year in order to enroll. They extended the open enrollment period first to April 15th. And about 2 weeks ago, they decided to extend it again because of the way the crisis was progressing to May 15th. So that means that anybody who didn't get health insurance when they first had the opportunity during the original open enrollment period, which was back in November to February, now have the ability to sign up for health insurance all the way until May 15th. So it's very important people go out there and get health insurance now because it's been extended.
Now, can we talk about health insurance and coronavirus? Because we were asking some questions previously about whether or not, if you didn't have health insurance, I know sometimes people are hesitant to go to the doctor, but I've heard they're saying that they will still test you for free. But then what happens if you are diagnosed? Do you have to get medication? Is the medication free? Is treatment free after that? What happens if you don't have that coverage?
Sure. Well, first and foremost, whenever somebody goes to the hospital, they're going to evaluate them to see what their financial ability is to pay. If someone is unable to pay right now, but they are eligible for insurance, they can go ahead and apply for health insurance. And what's happening right now is that most of the fees associated with paying a premium has been waived. People won't have to worry about not making a premium payment right now. Premium payments have been deferred for the next 4 months. So somebody shouldn't fear not being able to pay the typical monthly premium if they were in a health plan that had a premium. But some people qualify for Medicaid, some people qualify for the Essential Plan, which is free or $20. But either way, all payments for anybody who's eligible for the Essential Plan, Health Plus, or QHP has been deferred for the next 4 months. Now, if they're not eligible for public health insurance, all testing and treatment related to COVID is now going to be pushed under the emergency Medicaid program, emergency Medicaid. So either way, no one will have to pay for pay for their treatment or their testing for COVID.
Now, what happens after?
Even the rapid test?
Payment? Is it a balloon payment after? So now that you don't pay for 3-4 months, now is it all one shot and I got to pay it? Now, how can people pay that back? Because they're going to have to pay it back. But if I don't have a job or I'm not working, I got to get time to get on my feet. So how does that work?
That's a very good question. So if someone's not eligible, let's say they're undocumented and they're not eligible for typical public health insurance, they will be eligible for emergency Medicaid, which means that there will be no balloon payment. They won't owe anything after that because they're being covered under emergency Medicaid. Emergency Medicaid is free. There is no premium. There is no co-payments. It's a totally free program. So anybody who doesn't screen eligible for public health insurance, I'm talking about the Essential Plan or the Health Plus program or one of the Affordable Care Act or Obamacare programs, they will be able to apply for emergency Medicaid and they won't have to pay anything. There will be no balloon payment on the end. However, if they are eligible for public health insurance, we are deferring the payments for the next 4 months, and they will be paying that amount after that.
Let me ask you a question. If you have a pre-existing health condition and you've never had insurance and you get corona, will they still cover you?
Yes.
Okay.
Pre-existing conditions went away when the ACA, the Affordable Care Act, or Obamacare, was enacted, 7-8 years ago. So no one has to worry about having pre-existing conditions. They're going to be covered.
Now, there's a lot of people who are losing their jobs right now and therefore losing their coverage. So for people that is happening, unfortunately, they can go and still get coverage, right? That has been extended?
Absolutely. So I'm going to talk about a couple of things. So besides the fact that the open enrollment period has been opened up again until May 15th, they also now, because everybody's practicing social distancing, are allowing people to enroll telephonically. So no one has to leave the comfort of their home. They can call in and speak to a facilitated enroller and enroll telephonically. Now, to your point about people losing their job, we're encouraging everyone to have themselves rescreened. A lot of people who might have been in a program or a product where they had a monthly premium, I'm making this up, of let's say $200 a month, and could no longer afford it because either they lost their job or they were a restaurant worker and they were relying on tips. They should have themselves rescreened, because now that their income has changed, they're probably now eligible for a product that is much more affordable, like Medicaid managed care or like the Essential Plan that is either free or $20 a month. And so we're encouraging everyone, even those who already had insurance before COVID, who now saw their financial situation change, to go and get rescreened and see if they're eligible for a program that is much cheaper. They've also relaxed a lot of the eligibility and documentation requirements. So in the past, someone had to submit all these documents to prove income or their identity to prove identity. A lot of those requirements have now been relaxed, and they can do things through a telephonic three-way conversation between the consumer, the facilitated enroller who's helping them, and the New York State of Health. So people don't have to worry about documents as much anymore. They've set up a mobile upload app, so if you did have to submit some type of document, you can do it from your cell phone and just take a picture, and it gets uploaded. So there's a lot of things that the state did to relax the traditional eligibility and documentation requirements. Those are things people shouldn't worry about at this time.
Now, Dr. Shaw,
You
I'm sorry, go ahead, Yi.
No, you go ahead.
Dr. Shaw was asking, so for people out there that are listening that are scared, we hear so many different things. Things change every day. I mean, it's to the point where everybody's confused. What do you suggest people do at this point as far as going out? Should they wear gloves, not wear gloves? Is wearing masks? And, what type of mask should they be wearing? And if they do have it, how can they fight it? And how should they prepare to not get it? What should people be taking and doing at this point?
Very good question. Thank you for asking it. I think we should first recognize the tremendous efforts of New Yorkers to stem the rise of coronavirus. And you can see that in the fact that there are reduced hospitalizations in the last few days, reduced admissions to the intensive care unit. And I think we are beginning to flatten the curve. But that's only going to be maintained if New Yorkers continue to heed the advice of the governor and the mayor and all healthcare professionals, which is namely, if you're not an essential employee, you and your family should stay at home and practice. If you do go out, you have to practice social distancing. Now, if you feel very sick, I think it's important to speak to your doctor. Don't go to the doctor's office. Speak to your doctor about whether leaving your home to seek medical care is the right thing to do. And if for some reason you can't speak to your doctor, then certainly call 311 or the number 844-NYC for NYC, and they'll put you in touch with a healthcare professional to give you the advice that you're asking about. I think it's important that, if you must go out, practice social distancing. I used to say, take an apple a day and keep the doctor away. Now I say, take an apple a day and stay 6 feet away to keep the doctor away. And treat everyone, if you happen to go outside, you meet outside of your home, as if they might be infected with the coronavirus. The other big thing that's changed, as you've just alluded to in the last week, is that everyone, if they do go out, should be having a face covering. Now, that face covering could be a bandana, a face cloth. It doesn't have to be a medical mask, which is really, for healthcare professionals. But you should have a face covering. And that's so that the fact is that people can spread the virus if they are, even if they're without symptoms. It's called asymptomatic spread of the virus, and that's why the face covering is very important. And that's the newest thing that we've heard about. And again, I saw it this weekend. People were going grocery shopping. They had face coverings on when they went out.
Doc, let me ask you a question. Why is widespread testing something that makes people feel safer? Because I was reading this article that Joe Biden did in the New York Times yesterday, and that was one of his 3 things. He said widespread testing has to be available before we reopen the country. Why does that make people feel safer?
Well, I think it's 3 things, right? The first thing is people want to know if they're symptomatic, if they have the virus or not. And I think that's an important consideration. The second thing is that people may be shedding this virus without symptoms, and therefore widespread testing will create, make those people aware if they have the virus and make sure that then they're not spreading it to others. We're also going to be using widespread testing to do community tracing for people to see which areas of the community are having a high incidence of new cases of coronavirus versus other communities. I think right now the issue with testing is that there aren't enough tests to go around. So at this point in time, testing should still be reserved for people who are hospitalized with coronavirus. There's also testing for essential workers, healthcare professionals, to make sure that they either have to stay on the job or have to be back home, or if they or to make sure that they don't have the virus and they're not going to be spreading it to other people. And then I think we have to really look at communities that have been disproportionately impacted with coronavirus, particularly low-income communities, communities of color. And these are the communities who should get the extra testing once those kits become available.
Or
Do you think we're a lot closer to Medicare for all now at this point because we see what a pandemic has done to our country?
Yeah, I think that the idea that everyone should have some form of health coverage is something that resonates with everyone, right? What form that takes, whether it's Medicare for all or some of the options that Roger outlined. In New York State, fortunately, we have a lot of advantages for people to get covered through either Medicaid, the essential plan, through some of the health exchanges. And in addition, people who cannot be covered through their health insurance, there's an opportunity at health and hospitals for people to get coverage, even if you're unable to get health insurance coverage. So I think the idea that people should have the worry of whether their care is going to be covered for and to worry about health, bills or things of that sort, I think that is something that resonates with people now more than ever. So whether it's Medicare for all or some other type of coverage for all, I think that's an important advancement that this virus has really made all of us think about. And thank you for bringing that point up.
How can people enroll right now if they want to enroll? Just give them the website if they want to still enroll because they have until May 15th.
Mm-hmm.
Sure. So like I said, people can enroll telephonically now. I think they should really take advantage of this. They can call our 1-855-809-4073 number, and we have, over 300 facilitated enrollers all across the city positioned, ready to take their calls. Someone can also go to our website at www.metroplus.org, and they can fill out a Contact Us form. That form will be routed to one of those facilitated enrollers who can assist them, and they'll respond very rapidly to give people more education about what's available to them and how they can go about enrolling.
All right. Well, thank you guys for checking in. Roger Milliner, did I say that right?
Milliner. I just like to
Milliner.
Just one more thing. A lot of people are not aware of the relationship between Metroplus and the public hospital system. I know that everyone is really very proud of all of the hard work that the doctors and the nurses are doing within our public hospital system. We hear about Elmhurst Hospital all the time. And what you should know is that the listeners' audience should know is that Metroplus is a part of that system. The health and hospital system actually is the owner of Metroplus. So we're very tied together. And some of the things that are being done behind the scenes that don't get recognized, I just think that the listener audience should know. For example, the governor a few weeks ago put out a strong plea across the country to recruit more doctors that were needed, more pulmonologists who deal with the chest because of all of the respiratory issues that were going on. And Metroplus aided in that massive telephone outreach campaign that took place. And we were able to recruit over 1,100 doctors from all across the country to come into New York to work on the front lines with all of these people who are experiencing this virus. So I just wanted that to be known. Also, Health and Hospital, without the assistance of FEMA, did a great job in erecting all of these pop-up medical facilities to treat the overflow that was coming into the hospital. We hear about the Billie Jean King Center in Flushing. We hear about the hotels that are being utilized. There was a brand new hospital, I think 350-bed facility put on Roosevelt Island. These are all the things that Health and Hospital did without assistance from FEMA, and Metroplus was a part of that. We actually donated 400 of our employees to go work at these various facilities. So Dr. Shaw, he has all type of medical directors and nurses working in the hotels, working the Roosevelt Island facility, and working at Billie Jean King in order to do our part to assist the hospital systems. I know Dr. Shaw might have wanted to mention something in more detail, and I just thought that was important to note.
All right.
Doctor?
Yeah, so I mean, I think one of the things, one of your questions pointed out was this disproportionate impact in communities of color and low-income people, people who are disproportionately impacted with heart disease, lung disease, diabetes, high blood pressure. It turns out these are all the conditions that disproportionately are impacted with coronavirus. And I think, to Roger's point, health and hospitals and Metroplus are playing a huge role in really reaching out to these disproportionately impacted communities and making sure they get access to testing, they get access to urgent care, telehealth, which is so important. If you can't see your doctor, the notion you can connect with your doctor through your mobile device, I think that gives enormous comfort to people to be able to speak to a healthcare professional without leaving their homes. These are just some of the things that we're doing for our community. And not just the physical health piece, but the mental health piece. There's a lot of mental stress that's occurring as a result of coronavirus, and we're setting up a massive texting campaign to all our members to ensure they get their physical health needs met, but also their mental health needs met through things like the New York City Emotional Support Line, where you can text someone and you can speak to a mental health professional and get some of the other assistance you need, along with food, housing, unemployment assistance. These are just some of the other things that we're doing right now.
All right. Well, thank you guys for checking in and giving all the people all the information that they need.
Thank you.
Guys, be safe out there, man.
Thank you. You too.
All right. Cheers.
All right. Have a good one. It's the Breakfast Club. Good morning.